Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What's new with depression? Is it possibly related to an intestinal microbiome that is abnormal? Find out more right now. My guest this evening is Dr. Annie Kopera of Georgetown Medical Center. Annie, welcome to Housecall.
Hi, Dr. Doman. Thank you so much for having me. I'm excited to be here.
My pleasure, and please call me Dave. So briefly tell our viewers about your professional background.
Sure. So I am currently an internal medicine resident physician at Georgetown University Hospital. I'll be finishing this training this coming summer and starting my gastroenterology fellowship at the Medical University of South Carolina.
Congratulations. Sounds very exciting.
Thank you.
Before we go on, I should briefly explain to our viewers that we collaborated along with some of the gastroenterology fellows at Georgetown Medical Center, as well as a faculty member, Dr. Mattar, and one of my partners, Dr. Raena Olson. And we collaborated on an exciting paper summarizing the world's literature on the possibility that depression may, in many respects, reflect an abnormal intestinal bacterial environment. So the topic at hand tonight is to review for the viewers what is some of the preliminary information we've summarized. So briefly, tell our viewers what exactly is the intestinal ecosystem?
Sure. So this is something most commonly referred to as the gut microbiome. And the gut microbiome is this network of trillions of microbes that inhabit the human gut. And this is normal and healthy in all human individuals. The microbes that make up the gut microbiome include bacteria, viruses, fungi, and a host of other microbes. When the gut microbiome is balanced, so when it's normal and healthy, it offers its human host a variety of things. So it offers protection from dangerous pathogens that we may encounter from eating and drinking different things. It offers us some additional protection of the lining of the inside of the gut wall. And then it also provides us with essential nutrients. So the microbes that make up the gut microbiome actually offer and create vitamins and minerals that we need to function. When the gut microbiome is not participating with the human host, it is known as gut dysbiosis.
So it sounds like some bacteria are actually very good for the human host. Would you agree?
Exactly. So both inside of the gut and on the skin and other areas of the human body, we definitely need good bacteria in order to protect us from other pathogens that we may experience in everyday life.
Now, you mentioned gut dysbiosis, where the balance has been thrown off. What are some of the symptoms a patient may experience if things are not right?
Yeah, so when the gut microbiome is unhealthy or abnormal, some symptoms may be abdominal pain, nausea, vomiting, changes in bowel movements. The gut microbiome has actually been shown to have an effect on contractility of the GI tract. So that's often why sometimes patients can experience these symptoms. Other times it may be completely asymptomatic and someone may not know that they have gut dysbiosis.
Now, we've put together, as part of our paper, a schematic drawing that goes over the interplay between the human host and the intestinal bacterial population. Can you work through this schematic drawing to give our viewers a sense of the interesting relationship between the human host and the intestinal environment?
Absolutely. So this is an area that's being widely studied, and a lot of research is emerging in this field right now. So what we've put together is what's available of the research in the current database of what we think and how we think the gut microbiome relates to depression. So the first way would be through our endocrine system. So it's something called the hypothalamic pituitary adrenal axis, which is really our stress response in our endocrine system. And that's known to play a role in depression. So when that is upregulated, it's been associated with depression development. So in one way, some research has suggested that when the gut microbiome is actually abnormal, that can cause an upregulated stress response in the body, which may lead to depression. In turn, some research has also shown that when that stress response pathway is upregulated, that can have an effect on the gut microbiome and cause it to be abnormal. So right now in this current moment, we're not really sure which causes which, whether it's first an abnormal gut microbiome, which causes the upregulation and the stress response, or vice versa. But some relationship has been established between the two. So that's the first mechanism that we think is how the gut microbiome leads to depression. The second one has to do with the nervous system. So there's a nerve called the vagus nerve, which is a connection between your brain and the gut. So when the gut microbiome is actually making signals, it can directly communicate with this nerve, which has direct access to the brain, and then vice versa. So this is the second mechanism that we studied as to why the gut microbiome may lead to depression. And then the third pathway is the immunoregulatory pathway. So this is that the gut microbiome is actually creating these signaling molecules. So things like proteins and cytokines that signal to the brain to make changes. So there's been evidence out there that suggests that these signaling molecules can come from the gut microbiome and then send messages to the brain.
Excellent overview, which leads me to a very important topic that physicians have only begun to appreciate, and I'm sure most of the general public do not yet understand. And that is the phrase bidirectional relationship. Please explain this important concept to our viewers.
Yeah, so this bidirectional relationship is really the crosstalk between the gut microbiome and the brain. So if you notice when I was describing those mechanisms, it sounds like we don't really have a good idea of which thing is affecting the other. And that's because we think there's this bidirectional relationship between the gut microbiome and the brain, and that they're in constant communication with one another through those three pathways that we just discussed.
So it's not, as we all had understood years ago, that the brain has this overview, complete control over the body. There is that mutuality that we're now coming to appreciate.
Exactly.
So define for our viewers what exactly is depression.
Yeah, so depression is a clinical diagnosis that will be made by your physician. And there are specific criteria that we look for when we're diagnosing someone with depression. And it's one of the most common mental health disorders that we see and we treat in patients. So symptoms include things like low or depressed mood and loss of interest in your normal activities. And then some other symptoms include things like unintentional change in your weight, either gaining weight or losing weight, a sleep disturbance, and then losing interest in your normal activities, and then sometimes can be more serious and having symptoms like thoughts of harming yourself. So there are specific criteria that we look for as physicians to make that diagnosis, and these symptoms have to be ongoing for at least 2 weeks.
Historically, since depression as a diagnosis has been around for many, many decades, what are some of the traditional therapies doctors have used for depression?
So the standard of care right now when we're treating someone for depression, it's usually 2 things. So we like to start with therapy. So it's cognitive behavioral therapy, and that's either with a psychologist or a psychiatrist. And these are techniques to work through depression. And then the other is medication with drugs called antidepressants, and there are multiple different classes of those.
And do they always work for patients, or there are many patients where either or both therapies don't provide benefit?
Yeah, so unfortunately, these therapies don't work for all patients. So sometimes people do really well with one or with both. Other times people have slight improvement, but not full resolution of their depression. And then other times people have no response at all, and those treatments do not work.
Which means that our paper is opening up some very interesting potential therapeutic opportunities.
Exactly. So our goal as physicians is to really help our patients as best we can with their symptom resolution, to lead healthy and normal lives. And in order to help them with depression symptoms, we're definitely always looking for more options as to the underlying pathophysiology and additional things that we can give them to treat their disease.
As you know, one of the traditional medications to treat depression is the category SSRIs, selective serotonin receptor inhibitor, and they affect serotonin metabolism. How does that interface with intestinal bacteria?
Yeah, so one of the roles, so one of the mediators, like I was talking about before, that the bacteria in the gut microbiome create is called serotonin. So the serotonin that's made in the gut can be released to the rest of the body. And the serotonin that's released from the gut microbiome, it doesn't actually cross, there's a membrane around your brain called the blood-brain barrier. So it doesn't actually cross that barrier, but it plays a role in the overall metabolism of serotonin. So there have been some research papers provided out there that suggest this serotonin production in the gut microbiome may play a role in depression.
We're going to stop there for a public service announcement. More with my guest, Dr. Annie Kopera, and we'll be discussing the possibility that depression in many cases is due to an abnormal intestinal environment. We'll be right back.
Hi, I'm Ryan Blaney, a third-generation race car driver, and we dedicate a lot of our time to going as fast as possible. My grandpa Lou is the reason why my dad and I started racing, and I'm really proud to follow in his tracks. But when my grandpa was diagnosed with Alzheimer's, it was a very unexpected bump in the road for us. I've learned a lot on this journey with my grandpa Lou, and the memories of my grandpa will always be with me. And in our family, we're used to getting involved, and I encourage you to do the same, especially when it comes to caring for your loved ones. When I think about Alzheimer's and the impact it had on my family, I recognize that losing a race isn't such a bad day after all. It's important to notice if older family members are acting differently, experiencing problems with their memory, or having trouble with routine tasks. Talking about Alzheimer's can be really tough, but if you notice something, have a conversation with your loved one. Encourage them to see a doctor or offer to go with them. Early detection of Alzheimer's can give your family time to explore support services, make a plan for the future, and access available treatments. If you or your family are noticing changes, it could be Alzheimer's. Talk about seeing a doctor together.
We're back. My guest this evening is Dr. Annie Kopera, and we're discussing a paper we published about the possibility that depression may be related to an abnormal intestinal microbiome, a bacterial population. Annie, when we paused for the break, we were discussing the fascinating possibility that there is the opportunity for new treatments for depression because of the observation that many patients with depression have abnormal intestinal bacterial populations. So let's go on to discuss some of these potential treatments. Let's start out with probiotics, healthy bacteria. What is your sense reviewing the literature about their utility to treat depression?
Yeah, so probiotics are a common supplement that many of our patients take and that you can buy at the grocery store or any local pharmacy. And in the literature surrounding probiotic use in depression, these supplements are actually referred to as psychobiotics, so implicating that taking them may affect your gut microbiome and overall improve your depression symptoms. So for probiotics, this is definitely the most widely studied intervention on how manipulating the gut microbiome can have an impact in depression outcomes. So many studies have been done both in single therapy probiotics, so using only the probiotic in patients with depression, and then also in addition to the standard of care of what they're doing already for their depression. So this is therapy and then the antidepressant that they're taking. And there have been many promising studies that show patients who took probiotics had improvement in their depression symptoms about 4 to 12 weeks after taking these regularly. So I think it's really promising that these studies and trials have been done so far. There have not been large randomized control trials. So that's specifically what we look for as physicians before we make guideline changing recommendations to our patients to use a new therapy or intervention. But those are definitely in the works right now, and we expect those to be published within the next few years.
How exciting. So if we discuss probiotics, healthy bacteria, that means we also should touch upon prebiotics and dietary management. Are there any prebiotics, any sort of special diets that may shift the intestinal bacterial population and in so doing improve depression?
Yeah, so there have been a few studies that have been done so far that focus on diet and its effect on the microbiome, and then how that affected depression symptoms for patients. So specific diets that have been reviewed in the literature include the Mediterranean diet. So that's a popular diet really focusing on omega-3 fatty acids, lots of fruits and vegetables, lean chicken and fish. And that showed that sticking to that diet for several weeks changed the gut microbiome, and patients that did that had improvement in their depression symptoms. Other diets that have been reviewed in the literature include a plant-based diet, which also improved depression symptoms in patients. And then some other smaller studies that were done focused on fermented food, and then also diets rich in flavonoids, so things like orange juice. And those were smaller studies where the data wasn't really showing that there was an improvement in depression. But I think that in the next few years that there will be more studies specifically looking at diet and the effect of depression symptoms.
So some of our viewers listening, if they hear that you're describing potentially bad bacteria that may trigger depression, that begs the question in their minds, well, if it's bad bacteria, why don't you prescribe an antibiotic? What's the data on antibiotics in depression?
Yeah, so it's been suggested that maybe using antibiotics can target the gut microbiome and then be a treatment for depression. So there have been a few trials that have been done looking at giving patients the antibiotic minocycline specifically to help with depression. And a few of those have shown that patients had improvement in their depression symptoms when taking minocycline both alone and in addition to their already prescribed antidepressants. None of these studies specifically looked at the gut microbiome, so we don't know for certain if the minocycline was actually changing the gut microbiome.
Do you think that the new generation fecal microbiota transplantation may have a role? And first of all, please define for our viewers what we're talking about when we discuss FMT.
Yes, so fecal microbiota transplant is essentially taking a fecal sample with healthy gut bacteria and a healthy gut microbiome and implanting it into someone that does not have a healthy gut microbiome. So this is typically done in 3 different ways. So it can be done by a gastroenterologist through endoscopy, it can be done through an enema, or it can be done through freeze-dried gut microbiome that can be swallowed by a patient. And then those 3 mechanisms help to reconstitute the patient's gut with a healthy gut microbiome. So it's commonly used for, in our field right now, for specific kinds of recurrent infections. There have been no specific studies that have been done with FMT only used for depression, but what has been done is that patients getting FMT for a different indication have also been given depression scores, and then authors of these papers have looked at depression scores both before the FMT and then after. And patients have actually shown improvement in their depression symptoms after they received the FMT for a different indication. And some trials are being done now to specifically look at FMT use for patients with depression. So I think as gastroenterologists, we can definitely play a role in the next 2 years if this does become an option for patients with depression. So it's not as easy as, for example, taking a probiotic that you can get over the counter at your grocery store or pharmacy, because sometimes FMT does involve a procedure.
I think what's interesting about the whole FMT question, whether you deliver it endoscopically or whether you just take capsules, is whether, if it is successful, will one treatment be adequate, or do you need some sort of periodic retreatment, if you will, a maintenance therapy for depression? And that's not yet answered.
Correct. And the studies that have been published so far only go up to a maximum of 12 weeks follow-up in those patients. So they don't look further out. So a year or 2, for example, from when patients get FMT. So that will definitely need to be studied.
Yeah, because when you successfully deploy FMT, the question is, how long does it adhere to the bowel lining, or does it eventually get shed off? And if it's shed off, does the patient relapse, or do they still have sustained benefit?
Right. So when we talk about the gut microbiome and the things that affect it, things that can change your gut microbiome include your geographic location, what you're eating, what medications you take. So even if you're given FMT and you have a transplant of a new healthy gut microbiome, if after the fact you're exposed to all of these things that change your gut microbiome and go back to where it was originally, then that would definitely require a second treatment.
So what's some of the future research in your mind that's on the horizon with this exciting field?
Yeah, so I think the easiest and the most studied intervention are really probiotics. And I say easiest because it's a supplement that someone can take, and patients generally do well when they take a probiotic. Some side effects may include bloating, nausea, changes to bowel habits, but overall, patients usually tolerate probiotics very well. So I think we need large randomized trials. So these are trials that are going to involve many patients before we make any kind of recommendation change. And then I think the trials should really focus on what microbes are going into the probiotic, and then the dose of those microbes that are required to be effective to change the gut microbiome to improve depression.
Are there any particular probiotics, at least in small series, that have impressed you as potentially beneficial?
So the majority of papers mention lactobacillus strains, and that's usually seen commonly in over-the-counter probiotics.
Right. Okay. What do you think is the future of personalized medicine and this evolving field?
I think that the gut microbiome has the potential to be really revolutionary in personalized medicine. So when we talk about the current therapies that we use for depression, for antibiotics or for antidepressants, some studies have shown that the baseline gut microbiome of patients may affect how well medications work. So it's possible that in the future, we are able to sequence someone's gut microbiome to figure out what it's made up of before they start a therapy in order to predict how well they will respond to a therapy. In addition, I think that as we continue to treat patients and their gut microbiomes change, we'll have a better idea of exactly the makeup of what is known as a healthy gut microbiome, or what the gut microbiome looks like in folks who do not have depression, and then perhaps targeting that as our standard goal for what the gut microbiome may be.
Annie Kopera, thank you so much for a very informative interview. If our viewers have any questions, where should they go?
Yeah, so I think definitely engaging in conversation with your physician will be helpful. If you have any specific questions, you can definitely reach out to Dr. Doman, who is a senior author on this paper, with any specific questions.
Thank you for joining us this evening. My thanks to Dr. Kopera for an excellent interview. My thanks to the team for putting this program together. And my thanks to you, the viewer, for joining us this evening. Tell us how we're doing. You can reach me at my practice email. As for our next program, it's going to be very apropos to this evening. There is a national epidemic, unfortunately, of suicide attempts, both nationally and locally. So our next show will focus on suicide prevention. It's going to be an important show. See you then next time for another edition of Housecall. Good evening.